other diseases at about 2:30. So we will begin with some music now. And you can turn this off.
abed. The little Lord Jesus laid down his sweet head. The stars in the bright sky looked down where he lay. But little Lord Jesus asleep on the hay. The cattle are lowing, the baby awakes, but little Lord Jesus no crying he makes. The lovely Lord Jesus looked down from the sky and stay by my cradle till morning is nigh. Amen.
I'd like to welcome each one of you this afternoon to our exciting time that we're about to venture on, and that is with Dr. Sandoval, Mark Sandoval, who is the medical director and president of Uchee Pines Institute. And you may be familiar with that name, you may not. It's U-C-H-E-E, Uchee Pines, and you can go online, you can find Uchee Pines. It's a awesome lifestyle center. Maybe we'll ask, I don't even know, you don't have a video in your computer that you could show the promo video or go online and do that?
But I don't know if we can do audio.
Yeah, I don't know if we can do audio, but if we can, we'll show that before the end. But I'd like you to see this amazing lifestyle center. A lifestyle center is a place where people go to learn how to make lifestyle changes that will to help deal with diseases that have their fundamental cause or root in lifestyle, how we live. And so Dr. Sandoval will be talking about that, dealing with chronic disease. He was trained, did his medical school at Loma Linda University in California. His first focus was emergency medicine, and he felt called to redirect his interest to lifestyle medicine. And so that's his passion. And so he's president and medical director of Uchee Pines, dealing with people, patients that come looking for hope and looking for help. And by following the simple methods that God has provided in nature, you might say, by applying those principles, the body has an amazing ability that God has placed in it to heal. And so I hope that you will enjoy this time, and there should be some time afterwards for some questions and answers. And I'll just bring it to your attention, we'll be giving you a flyer. Next week we'll also be having a doctor here who's dealing with the issues around addiction and adverse childhood events and how they prepare people for addiction. And he'll be dealing with those kinds of how to overcome and have victory over bad habits and addiction. So that's showing the science behind it as well as the spiritual element to it. So let us begin today. We'd like to basically have a prayer and then just let Dr. Sandoval enjoy and presenting an amazing journey that he'll enlighten us, especially focusing on diabetes and reversing diabetes. But there's a connection between diabetes and every other disease. If you can reverse your diabetes, you can reverse many other diseases, and he'll explain that to us. But let us pray. Dear Heavenly Father, thank you today for the wonderful privilege that we have of being here together, for hearing words of wisdom, hearing words that you have that basically are words of love, because you love us and you want us, as your word says, I wish above all things that you may prosper and be in health. And Lord, you have provided the information, the knowledge for us so that we can follow you and that we can learn and grow and be healed. So as in the physical, so in the spiritual. So we're thankful for the total healing that you want to bring about in our lives. In Jesus' name we pray. Amen.
Thank you. Well, good afternoon. I will keep looking at eyelids. If I see too many of them following, then we'll have some more exercises like we did earlier. I recognize it's always a difficult challenge to speak to an audience after lunchtime, because there's certain physiologic processes that happen after that time, which usually draws blood to the digestive tract and away from the brain. But we will try to keep some of our attention. I am going to, as Pastor mentioned, I am going to be focusing on diabetes, but the principles that we talk about are applicable to cardiovascular disease, they're applicable to cancer as well, they're applicable to autoimmune conditions and so on. And there are benefits across a large spectrum of different diseases. So now honing in or focusing on diabetes, I want to begin by a discussion about how things normally function, because we need to understand how our bodies function. And then we can look at the dysfunction and then look at what do we do about it, so that the solutions that we talk about for the condition, we might understand why we're going to apply those certain things. So in order to understand diabetes, what we're going to do is we're going to imagine that you're going to eat a pizza. All right, so we're having pizza, and you can notice that it's a nice big yummy slice of pizza, and I used to eat the whole pizza in one setting. Not anymore. So you begin eating the pizza, and the pizza travels from your mouth along your esophagus down into your stomach, and once it breaks down in the stomach, that partially digested pizza enters your small intestines, where it's finally broken down into its small individual components, including glucose that can get into your sugar, into your bloodstream, and then when that glucose or that sugar gets into the bloodstream, some of it goes to the pancreas, and that's that organ, that yellow looking organ right here behind the stomach, in your upper central to left belly. And in that pancreas, you have a number of different kinds of cells. One of those types of cells are called beta cells, and this is an islet or an island, and inside of that you have these beta cells, and one of the things that those beta cells produce is they produce insulin. Now, we've all heard of insulin. That insulin is produced and it's released into the bloodstream, and it goes traveling through the bloodstream to the various different tissues of the body. One of those tissues is the liver. So the insulin produced by those beta islet cells, because of blood sugar levels going up, produces the insulin, gets into the bloodstream, and it goes to the liver. Well, the liver does a few different things. One of the things that the liver does is it makes new sugar, all right? It makes glucose. It can produce it. And another thing it can do is it has stores of molecules called glycogen, and glycogen is thousands of sugar molecules hooked together. And it can break down that glycogen, and so the liver can dump sugar into the bloodstream. So when you have insulin that now comes floating in the bloodstream to the liver, what it does is it affects both of these processes so that it stops them or it shuts them down. So under the influence of insulin, the liver doesn't make glucose and it doesn't break down the glycogen into glucose, and so it decreases the amount of sugar that's dumped into the bloodstream. Also, the insulin goes to your fat and your muscle cells in the body, and there's something that happens there. In each cell of your body, especially your fat and your muscle cells, you have receptors on the surface of the cell, these little blue guys here. And so out here, the little yellow balls are glucose, the little blue triangles are supposed to represent insulin, and those little blue triangles fit into these receptors on the surface of the cells, and those are like keys. The insulin is like a key that's fitting into the lock on the cell. And when that key fits the lock, it can open up the door. And the doors are over here. They're these little balls on the surface. And when those doors open up, then glucose can be taken from the outside of the cell into the inside of the cell. Now, when you take it from the outside of the cell into the inside of the cell, do you have more sugar in the blood or less sugar in the blood? Less, right? So as the key fits into the lock and opens the door, and the sugar can come into the cell, that means you'll have less sugar in the blood. So your blood sugar levels will go down as the glucose gets pulled into the cells. So here we have a schematic that I threw together. So you eat the food, right? So you eat it there, and as your blood sugar levels go up, the pancreas then produces that insulin, like those keys. Those keys then go to the different cells. In the liver, it causes the liver to stop producing glucose and to stop breaking down glycogen to form more glucose. And then in the fat and the muscle cells, that key hits the locks so that you can open the doors and the glucose can come out of the bloodstream into the cells, and then your blood sugar levels go down. So eating, blood sugars go up under the effect of insulin, and the blood sugar levels come back down. So that's how it works normally. Right? So that's just normal function for everybody who doesn't have diabetes. So what happens in diabetes? What is it that then begins to create this problem of diabetes? Well, every story has a beginning, and the story of diabetes begins at your own table. There are two predominant things that are necessary to begin the cascade of diabetes. One of those things is fat. One of them is what? Fat. All right. So fat is one of the major things that is the beginning of this cascade of diabetes. The other thing is inflammation. All right. So inflammation is the other key to the beginning of this process of diabetes. So fat and inflammation together are really the beginning of this process. So consuming a diet that is high in fat is the beginning of that cascade that later turns into diabetes. And the diet that has lots of fat is also the same diet that produces or promotes inflammation. And you can see that that's a lot of the yummy stuff that the world consumes. And the opposite of that is a diet that is high in fiber and has lots of antioxidants, because antioxidants tend to reverse or combat inflammation, and the fiber has basically an opposite effect that the fat has. So other diets can promote inflammation as well, including processed foods. And these are foods that contain sweeteners, white flour, added fats, food colorings, preservatives, other unnatural ingredients, right? The processed foods, they are inflammation promoting because of the contents that they have in them, and the body wasn't intended to deal with all of those contents. Also, foods that are produced with high temperatures. So high temperature cooking can also contribute to inflammation by producing inflammatory compounds and advanced glycation end products and acrylamide, and then there's a number of substances that are produced with high temperature cooking, especially in the context of proteins, and more specifically animal proteins, that are pro-inflammatory. So this combination of a high-fat diet and inflammation works together to decrease the number of insulin receptors of the locks in the cells. in the fat in those muscle cells. And so if you have, again, here's normal function, normal insulin production. So if you have this inflammation and this fat, what happens is it causes a change to happen in the fat cells and the liver cells and the muscle cells in the body, so that there are fewer and fewer of those locks for the insulin to be able to get into. And if there's fewer locks, then your body requires more insulin to occupy those locks fast enough in order to open up the doors to let the blood sugar into the cells. And so the pancreas has to respond to that by producing more insulin, and then more insulin. As the body becomes resistant to the insulin that's there by decreasing the number of receptors or decreasing the number of locks that are there on the cells. And so you have this response where the pancreas produces more insulin, but the problem is the pancreas only has a limit. It can only produce a certain amount of insulin, and in fact, as this whole process of fat and inflammation goes on, you start depositing more fat in the pancreas itself, and it creates its own inflammatory response where you get more inflammation in the pancreas. It's called lipotoxicity or fat toxicity. And as that lipotoxicity increases, it decreases the pancreas's ability to produce insulin. And in fact, some of those beta cells that produce insulin start dying off. And so you have this process that happens over a long period of time. If you look on this graph, it looks kind of busy, but we'll try to make it look not complicated. Here at time 0 is when you're diagnosed with diabetes. But notice that most people are on the process of diabetes development for at least 10 years before they ever develop diabetes. So it's a long process, and it's been going on for a while because of what two ingredients? Fat and inflammation, right? Notice I haven't said the C word yet. Carbs, right? Carbohydrates have very little, if anything, to do with the development of diabetes, right? When you develop diabetes, you then have a problem with handling the sugars, for sure, but its development has very little to do with carbohydrates, except for the highly processed carbohydrates and sweets. But even then, there are studies, they've done studies even in the military, 13 weeks of 1 pound of sugar a day. So basically all the way through boot camp. And a pound of sugar every day, no evidence of any kind of diabetes, any sugar spilling in the urine or anything like that, but only 2 weeks on a high-fat diet with healthy military recruits that are going through and basic training and so on. 2 weeks, and there's already early signs of diabetes, increased sugar in the urine, protein, and so on that's being spilled. And so it's really fat-driven, and it's not so much carbohydrate-driven. So here, you've got 10 years. Everything is looking nice and functional and doing well at 10 years in the past. But then as things progress, you start having a number of different changes that happen. Initially, your blood sugar levels increase after meals. So this one here, the red line, the postprandial glucose, that's your blood sugar levels after the meals. And so you can understand that because, well, if you eat after a meal and it gets digested and a lot of sugar gets dumped into the bloodstream, if the insulin's not working the way that it's supposed to because you don't have as many locks in the cells, it's going to take longer for that sugar to get down, and so it's going to spike higher. So your after meal blood sugar levels are going to be higher. But then the next response is that your fasting blood sugar levels start going up. Okay? So the fasting blood sugar levels go up. But why? Why do the fasting blood sugar levels go up? Well, we got to go back to the liver. Remember, under the influence of insulin, the liver stops producing sugar, the glucose, and it stops breaking down the glycogen and dumping it into the bloodstream. But when you become insulin resistant, the liver doesn't respond to the insulin like it used to before, and so the insulin, the brakes on the car aren't working anymore. Or they're not working very well, and so you slam on the brakes, it's not like the wheels lock up and you know. Now you slam on the brakes and like, and the next time you slam on the brakes, it's like, and eventually you're doing like what my brother did when he was younger and he didn't have any brakes, and so he just pulled the emergency brake. Yeah, telling stories. And so, yeah, so the brakes don't work anymore. So now the liver starts producing more glucose, and it starts breaking down more glycogen and dumping more sugar into the bloodstream. So your fasting blood sugar levels now are elevated because the liver is producing now all of this sugar because it's resistant to the insulin. And eventually you get to this point where notice that your resistance to insulin goes up, 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 up. That's that dark blue line up here. And then just below it is a green line, and that green line represents your pancreas's ability to produce insulin. And so as the insulin resistance goes up, your pancreas produces more and more and more and more and more, but eventually your pancreas hits its maximum, and it can't do anymore, and so it starts falling off. Once it starts falling off and the insulin resistance still continues up, now your blood sugar levels start taking off. And that's really where the diagnosis of diabetes comes in, even though you had been working on it for the last 10 years. Now you recognize that it's the case because your sugar levels are high and you've got certain symptoms that we'll talk about in a little bit. So our two problems are fat and inflammation. Now we've been talking about fat from outside of the body from a dietary standpoint, but it's also fat from inside as well, and especially the fat that's around the organs, the digestive organs, the abdominal fat or the visceral fat. It's highly enzymatically active, and it's involved in this process of inflammation and of insulin resistance as well. And so the more of that fat we have, then the more problems that we'll have with the insulin resistance as well. So this is where calories and calorie intake and weight gain and so on become part of the problem. And it's really a problem because, as you see here, this is a map of the United States. This is 1985. All the white ones, they're not turning in any data yet to the CDC. The ones that are in some form of blue, the ones that are darker blue, it's less than 15% of the population of the state that actually has obesity. And so that's 1985, 86, 87, 88, 89, 90, 1991. We have to add a new category. Now there's at least 15 to 19% of the population in several states, including Louisiana, Mississippi, West Virginia, and Michigan, that have at least 15 to 19% of the population that's obese. And we go on 1992, 1993, 1994, 1995, 1996, 1997. Now we have a new category. At least 20% of the population is obese. 98, 99, 2000, 2001. Mississippi leading the way with at least 25% of the population that is obese. We're going on to 2002, 2003, 2004, 2005, at least 30% of the population that's obese. And again, Louisiana, Mississippi, and West Virginia leading the way. 2006, 2007, 2008, Colorado is the only one holding on to blue. 2009, and boom, we lost Colorado, 2010. Now, they changed some of their statistics, so they changed their map in 2011, and so this is what it looks like, 2012 and 2013, at least 35% of the population with obesity. So you can see that this is a huge increasing problem, that we are getting bigger and bigger and bigger, and over a very short period of time. And it's not because of genes and genetics, because we don't have enough time to reproduce that fast. If we were mice, then we might be able to look at it and say, well, it might be a genetic problem, but we're not. Where people, and generations usually take, like 20 years or so for the next generation to come around, and we're looking at about 30 years of time, roughly, and, well, maybe close to 40 years of time, and a rapid increase in obesity. And what we find is that there's a strong correlation between the increase in obesity and an increase in diabetes. The top maps are showing you how obesity has been increasing across the United States from 94 to 2013, and the bottom maps are how diabetes has been progressing right along with it. And this is really scary because in the United States we only have about 9% of the population that's actually diagnosed with diabetes, but there's about 38% of the population that has prediabetes. And the vast majority of pre-diabetics go on to develop diabetes. And that's really scary because we cannot financially handle that many diabetics in the United States. We can't. Diabetes alone, you take out heart disease, which is the largest killer of Americans, you take out cancer, which is number 2 and is quickly becoming number 1, and you just look at diabetes, our economy cannot handle almost 40% of the population having diabetes and all the care associated with it alone, taking out all of the rest of it. And so we're looking at heading into some kind of crisis where either we go financially bankrupt, trying to continue to care for things like we currently are doing, or number 2, we decide to choose who gets care and who doesn't, right? Or number 3, we figure out some kind of solution to the diabetes problem so we can stop it in its tracks so we don't have to continue on down that pathway. I don't think number 3 is going to happen, because what it requires is self-denial on the part of people. And I don't think the population's there, right? And so we're looking at number 1 or number 2, and I don't like either of those scenarios. So how would you know if you actually have diabetes? Well, there are some classic signs like you have to urinate more, you feel thirsty, you drink more, and you lose weight, right? And you weren't looking at doing that, and all of those things are happening about the same time. Why does that happen? Well, the more sugar that you have in your bloodstream, the more of it you lose in your kidneys, in the urine. And where the sugar goes, water wants to go as well. So the more sugar you spill in the urine, the more water goes with it, and so your urination goes up. When your urination goes up, you're losing water, so your blood volume goes down. When your blood volume goes down, you feel thirsty so that you can replace that blood volume, and so you drink more. And so that whole process happens, and you lose weight because you switch to a catabolic state where you're actually burning up proteins and other things like that. And some people are like, woohoo, that's great, let's lose weight. But that's not a good way to lose weight. And if you continue on that pathway, well, it won't be good. Diabetes used to be universally fatal back in the day, especially type 1. So other signs, you can have blurry vision, you can have paresthesias, or pins and needles sensation, burning sensation, numbness, other things like that going on in the extremities. You can develop infections, especially like yeast infections and so on, because the immune system doesn't function quite so well when you have such high sugar levels and the body has all that insulin resistance. And when one does develop diabetes, there are many complications associated with it, like neuropathy, that pins and needles, burning sensation, numbness, and then you don't feel that you stepped on the nail like yesterday until you go walking around the same places where you did before, and you're like, oh, there's a little bit of red, there's a bit of red, there's a little bit of red, there's a little bit of red, and you're like, oh, you follow the trail around, and you realize you are the trail. Right? Like, oh, that's interesting, and you look and oh, it's bloody, and you look and, wow, there's a nail sticking in my foot and I had no clue. Right? And you've been walking around a day with a nail stuck in your foot and you didn't have any clue. You can imagine that infections would probably take off quickly from that standpoint. Then you have vasculopathy, the diabetes that causes rapid progression of vascular disease, and so the blood vessels become more atherosclerotic, poorer blood flow. With poor blood flow, then you have poor healing. And so you poke yourself with the nail. You didn't realize it because of the neuropathy. Now you've got poor blood flow, and so it doesn't heal well, and so infections take off. And then amputations. It's the leading cause for amputations in the developed world. Diabetes is. Cardiovascular disease, again, it increases the rapidity at which you develop atherosclerosis and heart attack and stroke and all of that kind of stuff as well. And it's the leading cause, it's one of the leading causes of death around the world, diabetes is. You have diabetic retinopathy, it's the leading cause of blindness in the developed world. Kidney damage, it is the leading cause of kidney failure and dialysis in the United States. And then cancer, bladder cancer, prostate, pancreatic, breast cancer, colorectal, and there are a number of other cancers that are that individuals are more susceptible to, and they're diabetic and they have higher blood sugar levels. All right? So all of those are complications that come because of diabetes. When we look at diagnosing the diabetes, of course, there's simple things that we can do. We can poke your finger and get a fasting blood sugar, or get it from a vein and find out what your blood sugar levels are when you're fasting. It should be, well, officially between 90 to 125 is going to be, well, officially it's going to be 100 to 125 would be pre-diabetes. But at Uchee Pines we use a lower level than that. We want you to have below 90 to be normal. Once you get into the 90s and you're consistently in the 90s from a fasting blood sugar level standpoint, I know in time your pre-diabetes, you're going to either develop pre-diabetes or you already got it and it's going to progress on from there. So we like to see your fasting blood sugar levels below 90. Hemoglobin A1C, that one is a blood marker that tells us how high or low your sugars have been on average for the last 3 months. And so, you know, you can't fool your doctor by going and eating all the ice cream and ice cream cakes and all of that other kinds of stuff and having your sugar levels really high, and then you're like, oh, I'm going to see the doctor in 2 weeks, so I'm going to, let's fast for a while and drink green juices and cut out all the sugars and get my blood sugar levels down so that we get a fasting blood test and it looks kind of good. But then they got a hemoglobin A1C and they look at the hemoglobin A1C and they go, oh, you've not been good. You've been naughty. And then there's the oral glucose tolerance test, which is where you take 70 grams of glucose, you chug it down after fasting, and they measure your blood sugar levels then, and at 1 hour and 2 hours after you do so. And at the 2 hour point, if your blood sugar levels are between 140 to 199, then you're considered pre-diabetic. Diabetes is just all the same things, just a little bit more. Fasting blood sugar is at least 126, hemoglobin A1C is at least 6.5, and your oral glucose tolerance test is at least 200. And then you've got the diagnosis of diabetes. So what about treatment of diabetes? Well, from a conventional standpoint, we've got problems. You know, conventional treatment for diabetes has to do with either pills or injections. That's the usual way that you treat it, and whether it's metformin or it's some type of insulin or it's gliclazide or one of the newer medications that are coming out for diabetes. There's a number of different options, but it's either a pill or an injection. The problem that we find with conventional treatment of diabetes is we cannot treat the diabetes with medication and get the diabetes into a normal range without increasing your risk of death. Right? So we cannot treat your diabetes with medication and get you into the normal range without increasing your risk of death. You know why you die? Because of hypoglycemia. Because your blood sugar levels go too low because of the medication, and you die from hypoglycemia. That's true in the intensive care unit, that's true in a regular hospital ward, that's true in a clinic outpatient setting, and that's true in a home. We've got studies looking at all of those different populations, and when you get really tight blood sugar control using insulin and oral hypoglycemic medications, once you get to a certain point, and it's around a hemoglobin A1C of 6.5 to 7, right around in that age, in that range. Some studies show 7, some show 6.5. Once you start getting below that, death rates start going up because of the treatment. And so, because of that, when you see your diabetes specialist, your physician or whatever who's treating you for your diabetes, they're going to target their treatment for you to optimize your diabetes care by keeping your hemoglobin A1C levels around 6.5 to 7. And once you're in the 6.5 to 7 range, they're very happy because that's kind of the sweet spot for treatment. But the problem with that is 6.5 to 7 will progress your diabetes. It will continue progressing, and the complications of diabetes continue progressing at those levels. And so it can't stop and it can't reverse your diabetes or the complications associated with it unless they increase your risk of death by giving you more medication in order to get it under better control. But then you die because your blood sugar levels are too low. So it's problematic. All right? Causes that life-threatening hypoglycemia. But when you do things naturally, you can get tight blood sugar control, get it down into the normal range, and do so without any risk of death, and without any increased risk of death, because when your body is not under the influence of the medication or the external insulin, then it has protective mechanisms like glucagon. It's another hormone that does the opposite of insulin. And so if the blood sugar levels start getting too low, then the body starts producing glucagon, and it will then start bringing your blood sugar levels back up. And you don't die from having low blood sugar levels. The only ones I know that die from low blood sugar levels are the ones that are on medication, or if they have a very rare tumor called an insulinoma, where the tumor itself is actually producing insulin. Those are really the only cases. So when we have diabetics at our center and we're dealing with them, one of the first things that I do is get them off their medication, because I don't want to kill you. Right? I don't want to kill you in that process, because I know what we do is going to start dropping your blood sugar levels. And if you continue on your medication and you're doing what we're doing, then we could kill you. And I'm not interested in you dying. Right? So this epidemic of obesity and diabetes cannot be adequately addressed through our hospital systems. It must be addressed at our own tables. Right? It's in our own power to make the difference in our own lives and the lives of our family simply by the choices that we make on a daily basis. So that's kind of information about diabetes. Now let's get into what do we do about it. First of all, we need equipment. If you're going to get on top of diabetes, pre-diabetes, or whatever, then you got to be checking your blood sugars. You got to be checking to see where you're at and see how your body is responding to the things that you're doing. And so that equipment is quite simple. Alcohol swabs, some lancets, people don't like that part. Glucometer, so to be able to measure your blood sugar levels, and then strips that go along with the glucometer, and then some gauze to dab things up. So what do? You use the alcohol swab to clean your skin, and you let it dry, and you get the lancet to poke the skin and get a little bit of blood, and you get a little drop, and then you dry it off, and then you squeeze off some more blood, and then you stick the strip in the end of the glucometer. The glucometer turns on, or some of them actually have the strips with them, and you just hit a button and it has the strip come out. Anyways, you put the strip in the glucometer, and then it's ready to go, and you get that little piece of blood in the end of the strip, and you put them together, and the blood goes up into the strip, and then it calculates what your blood sugar level is, and you can use the little gauze to dry up the blood afterwards. Measuring your blood sugar levels are going to be vitally, vitally important if you look at following the information that we're going to be talking about, because you need to know where you're at. Right? Now, if you're not diabetic and you're looking at applying these things, you don't have to worry about checking your blood sugar levels. Right? The body's going to maintain, and the advice that I'm giving for the diabetes will work very well for other disease processes too. If you are diabetic, and if you are on diabetes medication, whether it's oral, whether it's insulin, whether it's whatever, work with your doctor. Right? Work with your doctor. Do not Do not try to do this without the help of your doctor, because you could, following these instructions, you could kill yourself if you're doing it and taking the medication at the same time. Right? So you got to work with your doctor, and they know the medication and they know how things are going to respond. They probably don't know how to ever get anybody off the medication, because that's not something we're taught at medical school. We're taught how to put people on it and then tell them that they'll be on it for the rest of their life. We're not taught how to titrate or get them off of it. But that's fine. You be persistent, and if your doctor's not willing to work with you, then find another one that will. And then work with your doctor on this. So, when do you measure? Well, if you're not on any medication, you just have high blood sugar levels, you're pre-diabetic or whatever, then measure your blood sugars every morning before you eat or drink anything. Now, if you have water before you do that, that's fine. But if it's anything else that might have any calories in it, then you want to wait until, you want to take it before you have any of that. You want your fasting sugars. So that's okay to have before you poke your finger, right? So every morning before you eat or drink anything, you want to measure that blood sugar. If you are on oral medications, so you want to follow your physician's instructions, and so however often they say that they want you to measure, but at least once a day in the morning before you have anything. And then if you are on insulin, it depends on the type of insulin that you're on, but you want to know how you're responding to fasting, you want to know how you're responding to food and so on. And so it would be good to measure in the morning, 2 hours after breakfast, before lunch, 2 hours after lunch, and then if you have supper, then before supper, and then before bedtime. That gives you an idea of how your sugars are responding to meals and to fasting times, and how high you're going and how low you're going. Right? That's a good thing to know, and to keep it journaled, written down, so that you can keep an eye on how you're responding, and you can give that to your physician so that they can see a history of that as well and get an idea of how to advise you in regards to the insulin dosage. So let's see. So you're doing this and you're poking your finger. What you're looking for is somewhere between 70 to 89. That's the normal range that you're looking for as far as your fasting blood sugar levels in the morning. If you're pre-diabetic, again, you're going to be somewhere between 90 to 125. Diabetic is going to be 126 or more. If you're not fasting, if it's just random, then normal is going to be up to around 139. Pre-diabetic is going to be up to 199. And then diabetic is going to be anywhere 200 or above. That's just random, not fasting blood sugar. But you really want the fasting ones. So you might have met Ivan last year when I came. I don't remember whose story I told. I probably told his too. So Ivan came to us a few years ago, and he was obese and he was diabetic, and he had really bad neuropathy, so he couldn't feel really much in his feet. He was having vision problems. It was blurry. Glasses weren't helping him. He was hypertensive, had high blood pressure. His mind was foggy, wasn't thinking very well, and because of the neuropathy and everything, he was having a lot of difficulty walking. So that was Ivan's story when he came to us. What did we do? Well, what I'm going to be recommending to you is what we recommended to him. He applied the program. About a month later, we did some blood work with him, just like we did in the beginning. At the beginning, his fasting blood sugar was 173. His hemoglobin A1C was 12, which is bad, by the way. Should be normal would be 5.6 or below. But he was 12. Blood pressure was 153 over 102. His total cholesterol was 192. Triglycerides were 158. HDL was 36, and his LDL, which is a bad cholesterol, was 124. And again, he had difficulty walking. After a month of being on the program, his fasting blood sugar was 101, which is better. It's not, it's not where it needs to be yet. I want that below 90, but it's getting better. And his blood pressure was 90/70, which was remarkable. Sometimes we don't see that kind of blood pressure drop, but his was remarkable. His cholesterol had come down to 164. It's not ideal yet. I want that below 150, but it's going in the right direction. His triglycerides are ideal. They're 80. His HDL, which is his good cholesterol, has come up to 47, which is a good response. And his LDL, which is his bad cholesterol, is down to 101, which is better. But I really want it to be about 70 or below. Right? So there's some way to go there, but he's doing much better, and he's now training for, at that point, training for a 5K a month later. So that's a pretty remarkable turnaround. And in the process, he came to us on medication for his diabetes, blood pressure, and cholesterol, and we took him off of all of those. And that's the response. So he came off of all of those medications and all of his numbers improved, which gives you a little idea, a little sneak peek into the potential power for doing things naturally. Right? Now, do natural remedies fix everything? No, it doesn't fix everything. I haven't found a natural remedy yet that brings somebody back from the dead. So there are, there are limitations, and some things respond better than other things do. Diabetes is one of the ones that responds actually quite well to lifestyle and lifestyle changes. It's quite rewarding. Dave came to us, and he was obese and diabetic, and he had chest pains, and he was feeling miserable. And his life before, he had been healthy, had been on a plant-based diet some years ago. And as he said, he just let himself go because he was just really busy. And that's a picture of Dave, about 2 weeks before he came to us. He was doing a mission trip in Cuba. And there on the right is a picture of Dave about 5 months, maybe 6 months after he came to Uchee Pines. He had lost about 46 pounds at that point. And he was still on his process of losing more weight. And by his fasting blood sugar levels, it took about 6 months before they got down into the 80s. It took him about 6 months before it got down into the 80s. So he was still running into the questionable ranges until that point, but he stuck with it. He knew he didn't have self-control, and so he told his wife, "I'm not coming into the kitchen." For 3 months, he did not go into the kitchen. Not that he fasted for 3 months, but she prepared the food and the portion sizes, and she brought them out to him in the living room because he knew he didn't have the self-control to get near the fridge, or else he would start getting back into munching and doing all that stuff. And then after about 3 months, he had more self-control that he could handle things on his own. And so he reversed his diabetes, he reversed his heart disease, really working on his obesity. He lost over 50 pounds. Chest pain went away, and he had more energy than he remembered having in years. And he's a really big advocate for health now. Dave is our conference president, the Gulf States Conference. And so it's really neat being able to work with him. And then, of course, later he asked me to be part of the Health Ministries department for the conference as well. So, looking at overcoming diabetes, what are the things that we do? Step number 1, fast. But, I'm going to have a caveat with this. When it comes to fasting, only do this if you're off your medication. And if you're on medication, make sure you work with your doctor. Right? Make sure you work with your doctor with this. You do not, I'm going to say this again, you do not want to fast and be on medication at the same time. Diabetes medication. Now, other medications can be fine, like if you're on blood pressure medication or whatever, you can still take those while you're fasting, it's okay. Diabetes medication, you do not want to fast and be on your diabetes medication at the same time, because you can die, and I'm not interested in you dying. Okay. But fasting has a remarkable effect when it comes to diabetes. There are several things that you can get from fasting. One, you can you can get an idea of how bad your insulin resistance is. It actually can be quite diagnostic. Because let's say, for instance, your blood sugar level is 250. So you start the first day and it's up at 250, and so you fast. And what do I mean by fasting? You drink water. Right? And you see food over there. Right? So it's water. It's a water fast, right? So no calories, no nothing. And so it's 250 that first day. If by the next day in the morning you check your blood sugar levels and you're down to like 110, and then you fast that day and the next day you're down like at 90 or whatever, your insulin resistance really is not that bad. And it would be fairly easy, relatively easy, and I'm not saying easy, but compared to some other individuals, it'll be relatively easy to get your diabetes turned around. Now, if you're starting at 250 and you fast for the day and the next day you're at like 249 and the next day you're like at 245, you're probably not going to be able to get off of medication. You're going to be insulin dependent because without any calories whatsoever, your blood sugar levels really aren't coming down, you know. Now, over time, there's the possibility of you being able to get off of insulin and so on. But at the moment, we're not going to be able to do it without you being on insulin because we can't just fast you forever. Right? That's not a sustainable therapy. It's only a temporary one, right? But there's also something else that happens is with fasting, it promotes rapid weight loss, and weight loss is an important thing when it comes to diabetes and insulin resistance because the fat tissue is part of what contributes to the diabetes and the insulin resistance, and so as you lose some of that, then the insulin resistance starts improving. But there's also other benefits to the immune system and its function and so on that goes along with fasting. And so usually when we have somebody with diabetes that comes to the center, we'll be looking at a day to 3 days, more likely 3 days, of fasting, water fasting, so that, and getting them off of their medication before they start the fast. So you'd come a Sunday afternoon, evening, Monday morning, you'd see your provider, put a plan together for you. Tuesday you start your fast, but Monday we stop the medication. And then Tuesday you fast, Wednesday you fast, Thursday you fast, and by the time Friday rolls around, salad looks just lovely. That's another benefit to fasting, is that it fast tracks the change in your taste buds, so that you can enjoy that which you didn't enjoy before. Because if you haven't eaten for 3 days, I tell you, salad looks good, you know? Like, oh, hey, I can do this, right? Whereas before, you might not be able to do it so well. And so every day you're measuring your blood sugar in the mornings, and what you're looking at for is you're aiming for a fasting blood sugar below 90. That's what you're aiming for. And so if it's not below 90 the first day, then you fast another day. If it's not below 90 that day, then you fast another day. And if it's not below 90 by that day, well, if you want to keep fasting, you can. We usually don't push people beyond 3 days at our center because we also want to teach people how to eat. That's important too. And so if you fast too long, then you don't learn how to eat. All right, so that's the first step is fasting. But again, never on medication. Work with your physician if you're going to do that. It's very helpful when it comes to diabetes and getting the blood sugar levels down. Fasting, it's very powerful. Step number 2. First of all, we're going to go over the complicated, faster way of getting the blood sugars under control. And then we'll go over the simple but longer way of getting it under control. All right, so this is the complex, faster way. So if it's too complex for you, don't worry about it. Just hold on. The easier way is coming. So what you do, one of the things that you can do if you want to fast track your diabetes and getting over the diabetes, is you start on this program of introducing foods in the following order. So you start with raw green leafy vegetables, salad, right? Salad. You start with raw green leafy vegetables. And that's what you eat for, let's say for instance you're breaking your fast on Monday. So Monday you're eating salad. Breakfast, salad. Lunch, salad. Supper, nothing. That's right, nothing. We'll get the pattern here. All right. So you skip supper and then you go on. Tuesday, you measure your blood sugar levels. If they're still below 90 after eating salads for the day, then you can add in some cooked green leafy vegetables to your raw green leafy vegetables. So you can have some cooked kale and cooked spinach and so on. So you can have your cooked green leafy vegetables and you can have some salad. And you do that for breakfast and then you do that for lunch and then you skip supper. That's right. And then the next day you measure your blood sugar levels. If it's below 90 still, then you can add some raw regular vegetables in there. So you add in some broccoli and you can add in some cauliflower and carrots and tomatoes and whatever. So you can add in raw vegetables along with it as well. And you do that for breakfast and you do that for lunch and you skip supper. That's right. And then the next morning you measure your blood sugar levels. If it's still below 90, then you add in cooked vegetables along with that. And so you can have your raw green leafy vegetables, you can have your cooked green leafy vegetables, and you can add to that cooked broccoli and cauliflower and carrots and whatever else, plus the raw ones, and you have it all. And so your diet starts expanding. And if so you eat that for breakfast and you eat that for lunch and you skip supper, that's right. And then the next day you measure your blood sugar levels. If it's still below 90, then you add in some legumes, some beans, peas, and lentils, right? So now you're getting to some stuff that will fill you up and stick to your ribs, right? So you add in the beans and lentils and so on. And so, now you get to have some nice warm stuff and filling. And so you have that for breakfast, you have it for lunch, and you skip supper. Next day you measure your blood sugar levels. If it's still below 90, then you go on and you add roots and squashes. So maybe you have some potato or some sweet potato, or you have some acorn squash or something like that, right? And then you do that for breakfast, you do that for lunch, and then skip supper. And the next day, if your blood sugar levels are below 90, then you add in your nuts and seeds. And you get the idea, right? And the next day, you can add in your cooked whole grains like oatmeal, quinoa, brown rice, other things like that, right? And then the next day, you can add in your baked whole grains like bread.
What'd you say?
Bread. Like bread, right? And see how it goes. Then you can add in your low glycemic fruits. That's things like grapefruit, kiwi, lemons. Who eats lemons? And Granny Smith apples, and berries. That's right, berries. All of your berries are low glycemic, right? So adding in any of the berries. So then you add those in. And then if it's still below 90, then you can add in your other fresh fruits along with it. And if that's doing okay, you can add in dried fruits too, and add in your raisins and dates and so on. If you can get to 12 and you're still under 90 as far as your blood sugar levels are concerned, you're really wondering whether you have diabetes or not. Right? You're really wondering, because somewhere along this pathway, depending on how bad your diabetes is and your insulin resistance is, you'll find where your sweet spot and your bad spot is. Right? Because your blood sugar levels will start going up when you start adding that category of food. So what happens when you measure your blood sugar levels and the next day it's like 100? It's not below 90, it's up at 100. Well, if you run into that situation, then what you can do, so this example is all right, well, let me just go back here so I can point it out. So let's say that you were eating I'll go back to it, don't worry. That you were eating your raw green leafy vegetables, cooked green leafy raw vegetables, and so on. You were eating all the way through 6. You just added roots and squashes yesterday. And then today, you measure your blood sugar level in the morning and it's 100. Oops, it's above 90. Now what do? What you do is you fast for the day. Right? So it's another fast day. What kind of fast? Water and seafood. Right? Or maybe you don't want to even seafood because then your seafood will tempt you. Right? So you water. Right? So you water. And you just have that for the day. And the next day, if your blood sugar levels are below 90, then you can start eating again. But this time, cut out category 6. Because that's what you added in that pushed you above your level. So you're just going to pull that category out and you're going to eat from categories 1 through 5. And do that for a day or a couple of days. And then add 6 back in and see if that pushes your blood sugar levels above. If it does, then you know for a little while at least you're stuck with 1 through 5 and keeping your blood sugar levels under that. But insulin resistance starts reversing fairly quickly, and so what you'll find is that if you can't handle 6 today, you might be able to handle 6 by the end of the week or by next week, potentially. Right? And you can also exercise more in order to try to drive those blood sugar levels down so that you can tolerate a little bit wider variety. The other thing that you can do is if you were in that situation and you ate category 6, roots and squashes yesterday, and today your blood sugar levels are up at 100, since it was that category, you can just cut back on the amount of that you ate. You know, let's say that you got there and you were like, oh, roots, I can just eat like 3 baked potatoes today. And now your blood sugar levels are, up to 100. Well, maybe you want to back off to half a baked potato. And the other things, and see how your blood sugar levels do with that. Always in mind, keeping those fasting blood sugar levels below 90. Because if you can keep them below 90 and can consistently do so, you will absolutely reverse your diabetes. And many of the complications associated with the diabetes. Right? Now this is the complicated, fast way. Some of you were taking pictures, so you can, if you want to take a picture of that, then you can. Then I'll go to the next slide and you can take a picture of that. This is the complicated, fast way of getting rid of diabetes. 5, 4, 3, 2, 1. All right, next slide. All right, you can take a picture of that if you want to. So this is the complicated but fast way of getting over the diabetes. If it's too complicated for you, there's another option. And the other option is you can just eat a whole food plant-based diet and stick with it. Right? It'll take longer to get your sugars under control than the fast, complicated way, but it's more palatable and it's easier to follow. Right? And what is a whole food plant-based diet? Well, it's whole food, so it means it's the way that it grew. Right? You can recognize the thing. You look at it and you go, oh, look, it's like a potato. Right? Instead of looking at it and going, so what was that supposed to be? And I'm not talking about exotic fruits where you look at them and you're like, I don't even know how you eat this. That would still be a whole food and plant-based if it was an exotic fruit. But, it's like, it's so processed you don't have a clue of what the thing is. So potatoes are not so bad for you as potato chips or French fries, right? So the more processed it becomes, the less healthy it is for you. So whole foods are foods that contain all of what it grew with, right? Contains all of what it grew with. And so is juicing a whole food plant-based diet? No, because you're removing a lot of the fiber, right? And some constituents with it. Now, I'm not saying that juicing is something that you don't want to do or you wouldn't include with this, but it wouldn't fit the definition of whole food because you're removing some of the good stuff that came along with it. Now, if you blended it and you made a smoothie out of it rather than a juice, then you could still consider that to be a whole food, because now you're still eating all the fiber, although it's better for you if you eat it rather than the blender blades eating it. Right? It's better for you to chew it than for the machine to chew it. All right, so eating a whole food plant-based diet. Why is it that a whole food plant-based diet actually helps in reversing diabetes? Well, what caused diabetes in the first place? Fat and inflammation. Right? So fat and inflammation. And the fat that we find that promotes the development of diabetes is predominantly saturated fat. In fact, there are a number of studies that show that even a single meal of high saturated fat, whether it's like a hamburger or a steak or whatever, right? Even a single meal has a significant impact, has an impact on insulin resistance within a half an hour of the meal, and it also has an impact upon cardiovascular function and your ability to dilate and promote more blood flow even within 20 minutes of that meal. Right? So they're very rapid effects, and so eating healthy also has that rapid effect too. So within 20 to 30 minutes of having a healthy meal, a whole food plant-based diet that has lots of fiber, lots of antioxidants, phytonutrients, and so on that help to reverse the inflammation, fight against the inflammation, but also is low fat, within 20 to 30 minutes, the studies show that you have positive effects in the cardiovascular system and even with insulin resistance at that point. So it's very quick, but the whole process takes a while. Right? The whole process takes a while, but you see immediate effects. So step number 3, it's how you eat. That's really important as well. All right? So you want to watch how and when you eat. You want to make sure that you use your teeth. All right? You only got one set of teeth in the body, use that set. And if you borrowed some teeth from the dentist, that's fine, use those too. Right? More on a permanent loan, I don't think they wanted them back, right? You know, whether they were your original native teeth or whether they were ones that were put in, but you don't have teeth in any other part of the digestive tract, so use them here and use them well. Chew slowly, chew well, be thorough with that so that you have better digestion, because that will help. The slower that you eat the food, the more you spread out the digestion, and the less concentrated becomes the spike of blood sugar after a meal. You want to space your meals out at least 5 hours apart, because your stomach needs rest. So what about this thing about eating 6 to 8 small meals a day with diabetes? Anybody heard that one? Right? Maybe you've seen a nutritionist, and the dietitian or the nutritionist advise that you should eat small, frequent meals throughout the day. Well, there's some logic to it. Right? There's some logic to those small meals. One of the things that's logical about it is that the smaller the meal, the smaller the blood sugar spike. So you're not going to spike as high when you have that meal as opposed to a larger one. And it makes sense, and it's true. That's true. The problem is that what the studies show is that if you have fewer larger meals, and as opposed to the smaller frequent meals, the fewer larger meals actually have less blood sugar spike, less blood sugar on average over a 24-hour time frame, as opposed to one that has smaller frequent meals throughout the day. So the smaller frequent meals have more blood sugar on average over a 24-hour time frame, and more insulin need over a 24-hour time frame. So the small frequent meals actually promotes diabetes. So why do we keep advocating it if it promotes it? Okay. So big pharma and so on. It does have to do with big pharma indirectly. Remember what happens when you get good control of blood sugar when you're taking medication? You begin to die from low blood sugar levels. So if you're eating small, frequent meals throughout the day, guess what happens to your blood sugar levels? They stay up, right? So you're not likely to die from hypoglycemia because of the medication, because now you're eating frequently throughout the day and keeping your blood sugar levels up. But you just happen to be perpetuating the diabetes while you do so. Okay? And so we find that it is much easier to get individuals to reverse their diabetes by having fewer meals, and 2 meals a day tends to be the key. Some individuals can do 1 a day, but most it works out better with 2 meals a day. Breakfast and lunch, not lunch and supper. The 1 meal of the day that really messes up diabetes? Supper. That's right. That one really messes it up. Why? Well, because your metabolic rate is decreasing, you're getting ready for bed. When you eat later in the day and then you go lay down, more of that food is going to be shuttled into fat. And then what is it that promotes the diabetes? Fat and inflammation, right? So it's going to be contributing more to the fat, whereas if you eat those calories earlier in the day, it's going to have less of that impact on the insulin resistance and on the fat and its impact on insulin resistance. And then how many snacks? None. All right, no snacks. The only healthy snack is water. So if you need to eat in between meals, drink water. Water, 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 water. And water. That's right. That's right. So that's the thing in between meals. And since I said that so many times, it is our 4th step, which is drink only water or unsweetened caffeine-free herbal teas between meals. There are some herbal teas that we're going to talk about that do have benefit in helping with the insulin resistance. But it's not adding sugar to them or creamers to them or other things like that. It's just the plain herbal herbs boiled in water to make an herbal tea. And the reason why you want to just drink only water is because it has no calories. It's not going to cause your blood sugar levels to go up. It's going to cause your stomach to expand when you drink, so that you feel fuller. You're less likely to then munch on different things, and so it's really good and beneficial for you from that standpoint. And then you want to also avoid artificial sweeteners. So maybe some people are accustomed to, what is it now? It's zero. Which one has 0? Coke. All right, Coke Zero. All right, so you got Coke Zero, or you have something else that has some kind of aspartame or other artificial sweetener that's in there. The studies show that the artificial sweeteners, those who consume artificial sweeteners, actually consume more calories. Even though the sweeteners themselves, the artificial sweeteners, aren't a calorie source because you can't digest them, but they actually increase appetite. And so individuals who use the diet drinks or the diet whatever, they actually end up consuming more in the food that they eat along with it, because it increases appetite, and so you consume more calories. And also there are studies that show that the artificial sweeteners change the type of bacteria that live in the gut. And it changes the gut flora. And it selects for bacteria that promote inflammation. And remember, what is one of the 2 things that promotes diabetes? Inflammation and fat, right? And so they're finding that the type of bacteria that you have in your gut has an impact upon diabetes and insulin resistance, probably through its mechanism of inflammation and promoting inflammation. And artificial sweeteners select for bacteria that are known to be promoting inflammatory promoting bacteria. Step number 5, exercise. Exercise. Let us get our exercise. All right, now since we're a little bit fewer in here than we were at church time, let's stand up. All right, we're going to stand up. All right, hands up in the air. All right, fingers, 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 fingers. All right, wrists, wrist, 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 wrist. All right, now the opposite direction. Now do them with each other. Oh, yeah, this gets hard for people. And then the other way. All right, now arms around in circles. All right, just don't whack somebody in the head. All right, the opposite direction. All right, and then together. And the opposite direction. All right, off to the side. Stretch as far as you can. Oh, see if you can reach as far. Oh, that really feels good. All right, and then back. Oh, across. Oh, all right, now bend forward. Don't bang your head on the pew in front of you, but bend forward as far as you can. Oh, yes. Feel it pull in your back and in your hamstrings. Oh, down, 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 down. All right, and then standing up. All right, on your toes. And then back down. On your toes. And back down. And one more wiggle. All right, so you can sit down. All right, so exercise is really good for a number of different reasons. What we need to do is get moderate exercise. What does that mean? That means that you can talk, but you can't sing while you're doing it. That's moderate level. That you can talk, but you cannot sing with that. If you can sing, if you can bust out on the Hallelujah chorus, then it's low intensity, and you need to like pick it up a little bit. And if you're like, I need to, but I can, no, you can't carry on a conversation because you're so out of breath, then that's a high intensity, and you need to back off on that a little bit. So moderate intensity, where you could carry on a conversation, but you wouldn't have enough reserve to carry on a full song. That's moderate intensity, and especially right after meals. There are studies that show that for every minute of moderate intensity exercise that you have right after a meal, it decreases your after meal blood spike by about 3 points. Right? So if it's 10 minutes, you're looking at 30-minute drop in blood sugar spike. If you're 15 minutes, you're looking at up to 45-point drop in blood sugar levels right after a meal if you walk right after a meal. And walking is really good from that standpoint. So we call them digestive walks. So once you finish a meal, go for a walk. And you finish a meal, go for a walk. Then you skip your meal and go for a walk. Right? And that's really good. You want to avoid vigorous exercise right after the meals because that interferes with digestion, ends up pulling a lot more blood flow to the muscles and away from the digestive tract. So moderate intensity works really well. And combined, you want to get at least an hour of cardiovascular exercise every day. All right, so at least an hour every day that you want to get if you're looking at treating and reversing diabetes. And so you're looking at least 7 hours a week of that. And it's not really hard to do. And you don't have to get it all at one time. It doesn't have to be 1 hour all at one point. If you're doing it 3 times a day, you can do 20, 20, 20. Or you can do 15, 15, 30, or whatever. Right? And get that throughout the day. And then you want to add resistance exercises to that at least 2 times a week, hitting all major muscle groups. What are resistance exercises? Well, that's things like weights and resistance bands and exercises against some kind of opposing force. What are your major muscle groups? Well, arms, shoulders, back, chest, abs, glutes, thighs. Those are going to be your major muscle groups, and you're looking at least 2 days a week, 2 sets of 10 repetitions each. What's a repetition? Let's see, we'll use my wimpy water bottle. I have a more hefty water bottle, but it's in my van. Okay, so this is a repetition. So if we're doing like bicep curls, so that's a repetition. And if I do 2, then that's 2 reps. And if I do 3, then it's 3 reps. And if I keep doing that and I peter out around 10, which would be really pathetic, but if I petered out around 10, then that's a set. And then I take a break for a little while, and then I do another set of 10 repetitions. And then that's my exercise for that muscle group, right? I could also do it for triceps, right? And you can do the some triceps exercises there. Shoulders, you can do standing flies, or you can do military presses, right? Those all work the shoulders. For the back, you can have them, you can bend over and either do the reverse flies like this, or you can do rowing where you have it direct in front of you, almost like rowing a boat, right? All of that works the muscles in the back. For chest, of course, you can lay down and you can do basically, oh great, now it's the most common one, bench presses, thank you. You can do it with dumbbells, or you can do it with a barbell. With a barbell, it's bench pressing. Or you can do butterflies like that, or you can do modified push-ups, like if you have a very sturdy piece of furniture that you know is not going to scoot somewhere and leave you on the floor. Then you can lean against it and do like modified push-ups. That way, if you're not to the point of doing actually, regular military style push-ups on the floor. And so doing, arms, shoulders, chest, abs, back, thighs, legs, twice a week, every week, going through each major muscle group, at least 2 sets of 10 repetitions for each muscle group. There are several studies showing that resistance exercise has potentially a greater effect on reducing blood sugar levels than cardiovascular exercise. Okay? So there's some studies that show that resistance exercise actually has a greater effect on blood sugar reduction than cardiovascular does. So both of them are important to include. And it's nice to have the fitness and so on associated with that muscle mass and that exercise also. Step number 6: there are certain foods in particular that there are studies, research that shows that it helps with diabetes. All right, whether it decreases insulin requirements, whether it increases insulin sensitivity or decreases insulin resistance or brings blood sugar levels down. And those foods are your button mushrooms, the agaricus button mushrooms. They have been shown in studies to help with diabetes. Flax and chia seeds have also been shown to be beneficial, and flax is really good when it comes to high blood pressure too. Oats. Woo! So oatmeal, let us eat our oatmeal. And soy. Soy actually has a number of studies showing that soy consumption actually has positive benefits when it comes to diabetes. And when it comes to the flax and chia seed, you actually do much better if they are ground and if they're freshly ground. Right? So if you buy a bag of ground flaxseed and you don't get down to the bottom of it for like 8 months, well, it's not going to be so good. It's better to buy them whole and then grind them yourself. Have a coffee grinder or something like that. Throw a couple tablespoons in there. Grind it up, because usually if we eat it without grinding it up, we don't chew very well. And if you don't believe that you don't chew very well, then just watch what comes out into the toilet after a while and you'll find out how well you chew or you don't. If any of you have ever had a meal of corn, and you have ever seen the effects of that in the toilet, you know we don't chew very well, right? Because the ones that make it all the way through the other end are the ones that we just swallowed and we didn't really chew. And it's even worse with flax and chia seed because they're even smaller. So grinding them is a good idea. Oatmeal is a really good idea as well. Soy, there's various different versions of that. The green edamame soybeans, like somebody had a dish with pasta and edamame and whatever, and thank you, whoever that was. It was really good. Regular soybeans as well, tofu. Those are all good on the list as far as soy is concerned. Brief aside with the soy controversy, because some people won't touch soy because they think it's like the because it's GMO'd and 96-97% of any soy products that you get in the United States comes from a GMO'd crop, and soy has has plant-based estrogens, and guys might grow man boobs, and women it increases breast cancer and other types of things. These are all concerns associated with soy. After looking through the research and the studies related to it, it's not true. Yes, there are soy phytoestrogens like genistein, and those soy phytoestrogens are there, but what they do, you have two. In the last several years, we found out that there's not just one estrogen receptor, there's two, at least two. There's an alpha and a beta. And the alpha estrogen receptor is responsive to the body's own estrogen that it produces from the ovaries and the fat tissue and so on. And also exogenous diabetes. Exogenous estrogen that you might take, like a patch or a pill or other things like that. And those do promote the growth of breast tissue. It's known to be associated with breast cancer, ovarian cancer, endometrial, and so on, reproductive type of cancers. Well, the studies have shown that soy actually primarily impacts the beta receptor. And what they found is that the beta receptor tends to have the opposite response as the alpha receptor. But it has a positive impact when it comes on the bone, because bone marrow and bone tissue actually has a fairly high amount of beta receptors in it. And so there are a number of studies that show that consumption of soy actually improves osteoporosis and decreases fractures and so on in individuals that consume soy products. And there are a number of studies, and I've got them not in this presentation, but in another presentation I have them all listed. But anyways, there are a number of studies that show that soy consumption prevents breast cancer development. So those that consume more soy products actually develop breast cancer less. It's been used in breast cancer treatment, and individuals survive their breast cancer more when they consume soy, and there's less return of the cancer in individuals that have been treated with it. And it does not lead to feminization of men who consume soy products. Just doesn't. Right? So all of those concerns really don't fit. There are concerns when the soy products are highly processed. Right? So the more processed it becomes, the worse it is for you. You can make plastic from soy, and plastic is not a health food. Right? I'm not sure it'll ever make it on the health food list, but soy is one of the products that they'll make plastics out of. So you can process soy to the point where it becomes unhealthy for you. What is that point? Well, it's pretty clear that hydrolyzed soy protein is on the bad list. Soy protein isolates are kind of on the bad list, gray zone. Just plain soy protein is kind of in the gray zone. And then your tofu, tempeh, edamame, soybeans are on the good list. Right? That's where the research is kind of panning out. So it depends on what kind of soy that they use as to some of the results that they get from it. And so if you're using TVP as your protocol for feeding whatever study people or animals that you're doing, well, the TVP can progress cancer and other things too. Worthington will probably shoot me now. Because that hydrolyzed soy protein has been shown to be harmful. So it's not so much soy, but it's how processed the soy is as to whether it's bad or not. Now, number 7, get your sunshine. Right, that's a really important one. We're looking at about 15 to 30 minutes of sunshine daily. Why? Because of vitamin D. There are a number of studies showing that if your vitamin D levels are low, it's harder to get your blood sugar levels under control, and more people develop diabetes with low vitamin D levels. And so getting that vitamin D up is really important. You do want to avoid burning. Right? Burning is not something that is good. There's the question about sun exposure and skin cancer. I think there aren't any, well, I should ask, are there any dermatologists in the room? Okay, so we don't have to get into an argument. Right. So the dermatologists have done a very good job, conscientiously, mind you, right? Not with any ill intent. They're trying to save us from the sun. But they've been, they've had a really good campaign of getting people out of the sun, because then they have to deal with the skin cancers that crop up over long periods of sun exposure and burning and so on and so forth. Well, there was an interesting study that came out last year that I remember reading through, and what they were looking at was the disease burden or the death burden around the world because of skin cancer, and then the death burden around the world because of vitamin D deficiency. And what they were able to show in the study is that for every one individual, for sun exposure, increasing your exposure to sun for the population as a whole around the world, increasing sun exposure to the point where one more person out of 100 develops skin cancer, you'll have 100, well, no, I said 1 out of 100. It's not 1 out of 100. All right, let me try to say this correctly. That if you increase the sun exposure so that there is another individual that dies because of skin cancer, you will have 100 individuals that do not die from diseases related to vitamin D deficiency. All right? So you end up with more sun exposure, you end up many, many, many more people not dying because of vitamin D related diseases and dying from those diseases as those that would increase their risk of death from skin cancer. Right? So the story behind that is get more sun. Right? Get more sun. Because it has impact on diabetes, it has impacts on cardiovascular disease, it has impacts on dementia, it has impacts on asthma. Almost every body system that you can think of has some kind of impact when it comes to vitamin D deficiency. Now, how do you get your vitamin D? Well, if you go out there with your pinky and you burn that pinky to death, you are not going to get enough vitamin D. Right? It's just not going to work because you don't have enough surface area to produce enough vitamin D. So you're going to have enough surface area of the body in order to produce vitamin D. And it depends on your complexion as to how much of that surface area you'll need, what time of day, and so on. The more directly the sunlight comes through the atmosphere, the more vitamin D you'll produce at any given moment. Right? So the shorter time you need to spend. So if you don't have much time, midday is better than morning or evening. And summertime is better than winter, and so on. A non-cloudy day is better than a cloudy day, and so on, right? So the more direct the sunlight, the more vitamin D you're going to produce at any given time. The more skin you have exposed, the more vitamin D you're going to produce. So if you go out there with your pinky, sorry, it's not going to work. If you have half of your body exposed, you're doing the half skinny dipping thing, and whatever, then if you're a light-skinned individual, it will only take about 20 to 30 minutes for you to produce about 50,000 international units of vitamin D, which is the amount that they prescribe on a weekly basis for getting your vitamin D levels up into a normal range. If you're a dark-skinned individual, then it's about twice that. You're looking at around 40 minutes to an hour or so for that. Question? Okay, so I'll repeat that for those that are watching. The statement was that you've heard that that the majority of the sunlight, like even up to 90% of the good sunlight, is absorbed by the eyes and into the retina. The answer to that is no. The eyes are necessary, and sunlight is necessary for the eyes, but what happens with the eyes is there's a conversion of tryptophan, which is one of your amino acids, and with sunlight exposure to tryptophan in the back of the eyes, the retina of the eyes, it gets converted to serotonin. Serotonin is your happy hormone, and then serotonin at nighttime is converted to melatonin. And so it helps with serotonin and melatonin production. And so it's very good from that standpoint. But as far as vitamin D production is concerned, actually the best surface for vitamin D production is your back. All right, some studies have shown that you have more vitamin D production per square centimeter or so on the back than you do in other parts of the body. So yeah, getting your exposure and getting it on a fairly regular basis and having your vitamin D levels up are good. You're here in Florida, you're blessed. Right? If you were in Michigan right now, vitamin D pills, right? Because it's just not going to work. Number 8, step 8, get your rest. Right? So we're looking at about 7 to 9 hours a night for adults, 9 to 10 hours for teens, 11 to 12 hours for infants, and about 22 to 23 hours for lions. But you're not a lion, so don't try to be one. So those are about the hours that one needs on a nightly basis. There's variations there. Some individuals rarely, but some individuals actually can tolerate and do quite well on about 6 hours a night. Most of America is getting around 6 hours a night, and we're tremendously sleep deprived. And there's lots of complications with that. And in fact, there have been several studies that have been done looking at sleep deprivation and diabetes. And what they've shown is that sleep deprivation can cause diabetes. Right? Sleep deprivation can cause diabetes. In this particular study, they took a number of healthy college students. Of course, I'm not sure how healthy college students are. You know, I remember being in college, and my habits were not that healthy. So, anyways, they took healthy college students, and what they did is they sleep deprived them, and they gave them only 4 hours of sleep a night for 2 weeks. And after 2 weeks of being sleep deprived, then there were markers in the urine and in blood tests that they were doing. There were markers showing early changes of diabetic type changes. So spilling some more protein in the urine, starting to spill some sugar in the urine, higher blood sugar levels postprandial, after eating, and so on. So sleep deprivation can be a cause, and so you want to make sure that you get your sleep as well. We don't want to ignore that particular benefit. And it is true that early to bed, early to rise makes a woman healthy, wealthy, and wise. I don't know about men, but early to bed is a good idea. I'm just not sure about the wealthy part of it. It does help with health. And it is wise, but I'm not sure about the wealth part of it. All right, step number 9. There are certain herbs that have been shown, or supplements that have been shown to help with blood sugar control. Again, there are studies for all of these. I'm only including ones that I found studies for. There may be others that are out there, and there are studies for them. I'm just not aware of them. So if you know of them, that's great. But these are ones that I know that there's studies for. American ginseng. So that's that root up in the top left. All right, doesn't look that cute. Some companies will use ginseng as kind of like a root beer basis for like a root beer type of drink. Has that kind of consistency or flavor to it when you add enough sugar. So American ginseng is one that works. Astragalus, I don't have a picture for that on that. Astragalus is also beneficial for immune system function. And sometimes it can get you into trouble, like if you're taking astragalus and you have, let's say you have leukemia. Then taking the astragalus and having the leukemia can actually start shooting up your white blood cell counts, which is not necessarily a good thing. We've seen that happen a couple of times. There's berberine, which is an ingredient in golden seal, European barberry, Oregon grape, and there's a few other herbs that have it. Those are the common ones that we have around. So berberine has been shown to help with insulin resistance and decreasing insulin resistance. Blonde psyllium, Metamucil, Metamucil, I think, so blonde psyllium is actually really good when it comes to diabetes. If we were doing the high blood pressure talk, then blonde psyllium would come up on that one too, because it's beneficial for high blood pressure. And if we were doing the high cholesterol talk, then it would come up on there too, because blonde psyllium is basically fiber, right? And fiber helps to decrease cholesterol levels. So blonde psyllium is a good one as well. Cinnamon. Yeah, there are a number of studies that show that cinnamon actually has a good benefit when it comes to diabetes. It is amongst the spices. There are a couple of comments in Spirit of Prophecy in regards to cinnamon. None of them were good. But from a diabetes treatment standpoint, there are studies that showing that cinnamon actually helps with diabetes. Chromium. Some individuals don't have diabetes. What they have is chromium deficiency. So those beta cells that produce insulin, they need chromium in the process of the insulin production. And if you have a significant enough chromium deficiency, then you can actually develop almost an insulin-dependent diabetes, but it's not actually diabetes, because when you replace the chromium, it goes away. All right? So it's always worth trying. Right? It's always worth supplementing with chromium to see how it affects the diabetes. And also for those that do have diabetes and insulin resistance, chromium helps to decrease the insulin resistance. Now, the caveat with chromium is that if you have diabetes and you have kidney failure, or you have developing kidney failure, the chromium can speed up that process of the kidney failure. So we always want to make sure that we've got blood work that looks at kidney function and make sure that the kidney function is okay. And if your kidney function is questionable, I'm not interested in using any of the chromium. Fenugreek, it's kind of a funky, interestingly smelling grain, and it's kind of triangular shaped. It's almost like a weird pyramid or whatever. Some of them are kind of greenish, other ones are kind of brown. It's got an interesting kind of smell and flavor to it. That one has been shown to decrease blood sugar levels as well. We use that at the Lifestyle Center. We use it as a tea. But you could cook it as a grain and eat it. Ivy gourd is that thing up in the top right. And these guys are little. They're like that big. Right? So it's not like a whole cucumber. They're small, and sometimes you find this growing on fences, but not milkweed. Right? If you don't know what the thing is, don't eat it. And if you really know it's ivy gourd, then it can help with your diabetes. But it's not the fruit; it's the leaf. So using the leaf and either grinding it up and making a powder from it, or making a tea from it, or something. Magnesium has also been shown to help out with diabetes and decreasing insulin resistance. Milk thistle, which is that nice guy in the middle, it's not nice to poke into him, but he actually has really good benefits when it comes to liver function too. Milk thistle is a good liver aid, detoxifier as well, and it helps with diabetes. And then you've got white mulberry leaf. Maybe you've seen the usual purple mulberry. There's actually white mulberries that are out there too, and the leaf from the white mulberry can help out with diabetes. And then xanthan gum. That's usually something that you find in a health food store. It's used as a thickener, and it's a tree resin. It's a resin that comes from a tree trunk, and it's been shown to help out with diabetes as well. Step number 10, hydrotherapy. So one of the things that we do is fomentations to the pancreas. What's that? Well, on there you have a special heating pad called the thermophore. I find that those are very easy to use, especially in a home setting. They make them in Battle Creek, and there's various different sizes that you can get. Usually, usual heating pads, you can turn them on and they stay on whatever level that you put them on. Thermophores, at least the older versions, they had a trigger. So you couldn't just turn them on, you had to hold them down because they get hot and they might burn you. Right? And so you let go of the trigger and so on. We just get away from that because we bend the cord and put a rubber band around it and hold the trigger down and use it that way. But anyways, the thermophore gets nice and hot, and it creates a moist heat. That's really the idea behind it. That's why it's special. It's not a dry heat, it's moist heat. When it's moist, it communicates more heat to the body quicker and can heat things up faster. And so the pancreas, again, is right behind the stomach. It's up in the center just a little bit to the left. And so using your heat over the area, and you're looking at about 3 to 5 minutes of hot over that area. And then you remove that, and you have a bowl with ice water and a washcloth or a hand towel, and you wring it out a little bit, and you go, and somebody goes, because it's cold, and you do that and rub it around and get it all nice and cold for about 30 seconds, and then you put the heat back on, and you leave the heat on for 3 to 5 minutes, and then you go back to the cold, and you go, well, it's not that bad the second time, I know. And you put your heat back on for 3 to 5 minutes, and then you pull it off, and you do the cold, and you're like, okay, that's tolerable. And then you do the heat for 3 to 5 minutes, and then you do the cold, and you're like, oh, that feels pretty good. And then you put the heat back on for 3 to 5 minutes, and then you take it off, and you're like, oh, please give me the cold. And because it just gets hotter and hotter over time. And so you do that, the 5 to 7 exchanges, 3 to 5 minutes hot, 30 seconds cold, back and forth. What does that do? Well, heat causes the blood vessels to dilate. That's a response through the nervous system. You apply heat, causes them to dilate. You put cold on, causes them to constrict. Well, the heat gets to the surface first, so it'll cause the surface blood vessels to dilate. And then as the heat starts penetrating deeper, then those blood vessels will dilate more and more, and it brings more blood to the area. Then when you put the cold on, it causes the superficial blood vessels to constrict, to clamp down, and as the cold penetrates more and more, it'll cause them to clamp down as well. And so then it's a way of pulling blood to the area and then forcing it away. Pulling blood to the area and then forcing it away. And some of the forcing it away forces it down. Right? And then some of it out. And so it's almost like an accordion effect of pulling it in, pushing it away. Pulling it in, pushing it away. And you manipulate blood flow that way. And the more blood flow that you can get to the pancreas and the other organs in that area, typically the better they function. Right? That's the idea with the hydrotherapy over the pancreas. Step number 11, don't tell me. Avoid fatty foods. Right? So things like oils, condiments, margarines, fried foods, and so on and so forth. Right? Because what is it that drives the diabetes? Fat and inflammation. That's right. So you got to cut out the fats. Really, fixing diabetes is not about cutting out the carbohydrates. It's about cutting out the fats, because that's what drives the thing in the first place. And if we don't know that, then we approach it the wrong way, and we'll eat all the fats we want to and try to limit the carbohydrates. That's not how it works. There's a number of studies that show that using a whole food plant-based diet, if you increase your carbohydrates, you actually improve your diabetes. But they're carbohydrates that have fiber in them. Right? They're not the processed carbohydrates, sugar and candy and all that kind of stuff. So you want to also avoid animal foods, and that includes everything like flesh foods, dairy, eggs, ice cream, seafood, fish, whatever. Right? If it's got a face or a mother, don't eat it. Right? If it can run, swim, and fly away from you if you try to kill it and eat it, don't eat it. That's right. Leave it alone. Why? Because it has lots of fat, and it has lots of saturated fat. And that saturated fat is a strong driving factor when it comes to the diabetes. And so if you continue consuming the things that cause the diabetes in the first place, well, I don't know a single center I'm not aware of. And if you are, then you can inform me. But I am not aware of a single center around the world that is involved in reversing diabetes that includes any animal foods in their diet. I don't know any. None. But there are a lot of them around the world. I mean, we've got trainees that have gone through our program, and they're in Serbia, and they're in South America, and they're in the Caribbean, and they're in Asia, and they're in all over the place. And then there's others that I know of that I've never trained and I've never been involved with, but I know their centers, and we've talked and whatever, and all over the place. I don't know a single one that includes animal foods as a part of their program. Why? It doesn't work. You can't reverse the diseases when you include the animal products. You just can't. Just can't. All right, so you got to cut it out. Flesh foods, dairy, ice cream, and yada yada, all that kind of good stuff. Cheese, yes. Oh, that one was so hard. That one was so hard for me because I really lived on cheese and I love cheese. And I'm not saying it's easy. I'm just saying that's what you got to do. Right? And then you want to avoid the processed foods, right? Sugary foods, sweeteners, white rice, white flour, white bread, white pasta, white whatever. So you want to make sure if it's a grain, it's a whole grain. And it's got the fiber along with it. It hasn't been enriched. You know what enriched means? Take out 21 nutrients and put 4 back in. So you're enriched. Right. So anyway, so you want to avoid all those processed foods, fried foods, oils, condiments, margarines, yada yada. Cut out the fats, cut out the animal foods, because those are really going to damage your diabetes. Step number 12, lose weight. All right. Because fat, your abdominal fat and the other fat in the body is going to increase inflammation. Remember, inflammation is a driving factor for the diabetes. It increases free fatty acids, and that also worsens the diabetes. It produces hormones that lead to insulin resistance as well. And all of those cause insulin resistance. So if you decrease the fat, you decrease the insulin resistance. So weight loss is a major thing when it comes to diabetes. And so the diabetes improves, and the studies show that at least 7% body weight loss. There are measurable changes in insulin resistance with just 7% of body weight that's lost. Now, some individuals are already skinny mini already, right? And it's going to be harder for you because you don't have that component of weight loss that you can tolerate, right? Some of us look at it and we go, well, I can't actually handle weight loss. But if we calculate your body mass index, we look at it and we go, well, actually you could lose 10, 15 pounds. You'd still be within the normal range, and it might have a significant impact upon your diabetes, right? But you'd have to look at that with your provider. And then step number 13, our last step, fast. 1 to 2 days a week, right? So this decreases the overall calorie intake. There are also, when we look outside of diabetes, longevity. Individuals that do more fasting, they eat less food, they fast more, they live longer. Right? It seems to be that the more food you eat, the sooner you die. The less food you eat, the longer you live. There's, of course, a cutoff there. You can eat too little and you can die. But there's that kind of delicate balance that's going on there. And with the diabetes, every day that you fast, it helps to reset the blood sugar levels lower. And so you might be in a situation where you're eating that whole food plant-based diet, your sugar levels are kind of climbing throughout the week, and then you have a fast day, and it's kind of like resetting. And then it can climb a little bit, and then you can have a fast day, and then it kind of resets it. And it's a way of helping to kind of control the diabetes. It's also a way of helping to speed up the weight loss if you're looking at weight loss associated with it. And it has effects with the immune system and so on. So in summary, you want to measure your sugars often. You want to work with your doctor, especially if you're on medication. Do not fast while you're on medication. On diabetes medications. But fasting is very powerful when it comes to diabetes and diabetes reversal. You want to make sure that you're eating a whole food plant-based diet and avoiding the things that are not a whole food plant-based diet. You want to exercise on a daily basis. Right? 3, 2, 19, 18, 17, 1, 0. Boom. All right, you want to exercise daily. You want to make sure that you're eating about 2 meals a day, breakfast and lunch, and skipping the other ones. Only drink water and or your sugar caffeine-free herbal teas. Why caffeine-free? Well, caffeine, even if you had caffeine that had no sugar in it, if it was like black coffee, it can increase your blood sugar levels by about 28%. Just the caffeine itself, because it's a stimulant, and so it causes an increase in glucocorticoids from the adrenal glands and so on, and kind of a stress response. So it increases blood sugar. Use herbs or supplements as needed that we talked about, and trust God and to help you with that process, because your greatest tool is consistency. Right? The greatest tool is consistency, and it's God who gives you the consistency. Because otherwise we're a mess, and we look at things and we're like, we really are seafooditarians, right? We see the food and we're like, oh, I got to eat that, you know. Sorry, I made up that word. There's another word that we make, huh? Yeah, we joke in our home, we wordize. Make up words, right? Yeah. So we wordize to describe wordizing. And so, yeah, trusting God to help you. He's the one that can bring the consistency in your life for that. And for those of you that are interested in further resources, we've got a whole bunch of stuff available for you as well on UG Pine's website, ugpines.org. There's a section of the website called Counseling Sheets. You can either scroll down and find it, or on the top there's a section called Health. You click on that, and then one of the options is Counseling Sheets. We have over 500 different counseling sheets for various different diseases or conditions or whatever, and what you can do naturally in order to deal with that. And so we do have things on diabetes is there as well, including a type 2 diabetes treatment protocol that I put on there a few years ago. And I also emailed Pastor a handout that is not available currently, and I don't know, maybe you can email the church and they might be able to email it to you so that you can have it. It's basically kind of a transcript of the presentation. So the counseling sheets is really helpful, and a lot of people use that, and in fact there are a number of centers around the world that use our counseling sheets for their protocols for treating individuals, which is quite interesting. And then also we have a YouTube channel. So YouTube channel, we've got all sorts of videos on there, probably, I don't know, I think we're probably around 120 or so videos that we have available from different seminars and so on that we've had. And so you can find more presentations there related to diabetes or other disease conditions and how you can look at treating those. So those are available for you as well for free. All of those are free. What I'm going to do is I'm going to pray, and those who want to run away can run away, and those who want to, Pastor, ask questions, or just pray and let things go. I'll let you decide.
I'll let you pray.
Okay. Let's pray. Dear Heavenly Father, we thank you for your love and your mercies to us. We thank you that there are simple yet profound ways that we can cooperate with you in seeking healing and health. And these are things, we've been talking about diabetes, but it's applicable to many different things as well, many different diseases. And really the locus of control is with us. It's not with the world and society and so on around. We have responsibility for our own appetites, our own diets, our own exercise, our own health and healthy living. But we've realized and we've found that we can't do it ourselves. We just keep failing over and over and over again. And so, Lord, we need a power outside and above ourselves to be our consistency and to be our strength. And as we talked about this morning in the sermon, we realized that comes through surrender, complete surrender to you, and dependency upon you, of letting go of the rope and getting into the wheelbarrow. And so, Lord, we choose to do so, and empower us to obey you and to follow and experience all the health that you have designed for us, we pray. In Jesus' name, amen.
So you're going to have a question and answer period just for a few minutes?
Whatever you decide.
Yeah, totally.
I'm available.
I appreciate that. We appreciate you and your family. It's been a joy to watch those little girls go running in and running out, running in and running out. They've been having a good time. And, it's amazing how children can sit as long as these Sandoval children, and we appreciate that. And they're great. For those that were here earlier, we enjoyed their singing and their talent and their gifts, and we appreciate Dr. Sandoval if you want to hear an extremely good sermon on how to have victory, you will be truly blessed by going to our website. Go to Umatilla SDA on YouTube, and then it'll have the service this morning, and just scroll along, just move along until you come to the sermon part of it. Stop at the special music for the children and then listen to that, then move on to the sermon. It was very, very practically talking about, for those who didn't see it, the wheelbarrow and the cord and letting go and surrender and all those kind of things, but ultimately how to have victory, how to move ourselves beyond wishing and hoping to be what we want to be, to actually having the power to live the life that He's called us to live, and which means overcoming these kind of issues. Also, I'm going to have Jerry, he's going to give out right now, for those who would like one, and this is Dr. Ramirez. He's going to be speaking next week. He's also in the area. We're always blessed. At least once a year, Dr. Sandoval comes, because he and his family have family, as Mom is living over, and Mrs. Sandoval right here. I'm assuming that's the last name. Is it
Yes.
Mrs. Sandoval?
Mm-hmm.
Yes, okay, good. And living over in the Lady Lake area. And so we are always blessed to have you and your family with us. And we have another doctor whose family is in this area here, Dr. Ramirez. And he is going to be speaking next week. And he's going to be dealing with addiction, overcoming bad habits, adverse child events, and addiction, finding hope and healing. He'll be speaking in the morning. And that's going to be a very interesting talk. And then he's going to speak in the afternoon as well. So that's coming up. So it's worth putting that in your calendar as well. If you go to the website, Uchi Pine's website, you will see their video, and they have programs. They have. How is your program? Is it a 10-day or is it a 3-week?
17-day.
17-day live-in. So if you want to get coached and you want to learn how to live healthier, and you want to have the team there work with you, the doctors and the team, that's a really good live-in setting. You can learn a lot. Then when you come home, you can continue on with what you learn there. I know that you can find that very interesting, and you can get all the information on the website. Also, for those who know Uchi Pines, you can go to the 50th anniversary when the doctors Agatha and Calvin Thrash started Uchi Pines back in 50 years ago. So what's the math work out to? Is that 68? That adds up to? 1968? That's amazing. My wife Denise was there in 1975, and I lived and worked there from 78. Well, yes, that's right. 70. I was there 79, 80, and 81. Left in 82 actually. An excellent place, amazing. Okay, so are there anyone here who has been at Uchi Pines? Anyone who's been a patient at Uchi Pines? Or patients? Anyone? Okay, Eric was there. Another gentleman, John's brother Jim, was there. And so if you wanted to learn a little bit more about Uchi Pines. And anyone visited Uchi Pines? Yes, excellent, awesome. Great experience. Yes, Dolores, many, many years ago, when you lived there, Denise. Yeah? That's cool. Yeah, and you visited. That's great. And when Denise was living there, I'm assuming. Anyway, I don't want to hold you any longer, but for those who need to go, you can go. If anyone has a question, or you want to stay and listen to the questions or have a question, by all means. Thank you so much, and really, really, really appreciate your coming and sharing, and it's been highly enlightening. What do you think? Has it been enlightening, folks? Amen. Amen to that. Okay.
All right. So that.
Right, microphones are asking.
All right.